In the Anishinaabe or Ojibwe culture, childbearing is both a privilege and an honor. Childbearing is considered a natural part of life. The Anishinaabe use many different herbs and remedies to increase their likelihood to reproduce, to aid in symptoms of pregnancy and childbirth, and in post-childbirth cleansing. Anishinaabe females begin preparations for pregnancy even before they are able to reproduce. Around the age of 9, they begin drinking infusions of either alfalfa or white sweet clover to reduce the pain experienced during menstrual cycles. Infusions are made by soaking plant material in water. These infusions are also thought to diminish the risk of excessive blood clotting after childbirth if used daily. Once females experience their first menstrual cycle, they begin to eat blueberries before and after each menstrual cycle. This helps to maintain adequate levels of iron and phosphorus in the blood. If a woman is having difficulty conceiving a child, they may begin drinking decoctions of hazelnut, bush bark, buttercup, or water lily to help them become more fertile. Decoctions are created by boiling down and concentrating plant material. Both the males and females will drink these decoctions in order to increase fertility. Once a woman becomes pregnant, she may experience different symptoms, such as indigestion. These symptoms can be alleviated with the use of herbal remedies. Indigestion can be reduced by drinking mint tea made from peppermint, mountain mint, spearmint, or calamint. Constipation can also be relieved by drinking an infusion of flax seeds or eating porridge made from plantain leaves. In the last month of pregnancy, bear tallow, or fat, is rubbed on the perineum to attempt to increase the elasticity and to stretch the skin enough to avoid tearing during childbirth. Shortly after a woman goes into labor, a birthing hut is constructed. The hut is made from white cedar and typically near running water. Within the hut, a hole will be dug into the ground and filled with bracken and sweet ferns. A bar constructed from the branch of a beech tree aids the woman during labor. Although the pain in childbirth is unavoidable, Anishinaabe women are encouraged not to cry out or scream during childbirth. It is believed that newborn children are highly impressionable and that they may become more hostile later in life if they are born into an environment filled with screams of pain. The Anishinaabe have found that an infusion of bearberry leaves or the root of an American elm tree can work as a topical anesthetic. These infusions are rubbed on the perineum during childbirth to reduce the sensation of pain in the area. Infusions of willow bark or bloodroot can be ingested during childbirth to be used as a general anesthetic. If a woman is having difficulty during childbirth, corn smut may be used to induce contractions. Corn smut is a fungus which grows on sweet corn. The liquid inside the nodules is ingested for medicinal use. Corn smut should never be used on a patient who is bleeding heavily. It decreases clotting of the blood, which may lead to death. An infusion of groundsel or the upper foliage of a root of blue cornhash may also be used to induce contractions during pregnancy. Once the child has been born, sphagnum moss is used to clean the newborn and the mother. Sphagnum moss has natural antibacterial and antifungal properties which can help fight infection. The moss is used for many different purposes as it can retain 20 to 25 times its weight in water. This moss also prevents against toxic shock syndrome when used as a sanitary napkin. The preparation of this moss is a very delicate process. When picked, the moss must cut away from any mud or dirt. The moss must not touch the ground as it may be contaminated with a fungus which can cause infection in humans. The moss is then dried in the sun and can be used multiple times if cleaned and dried properly. The newborn is also anointed with white cedar oil. This oil is used to encourage and ease the newborn's first breath. The infant is cleansed with Monarda oil, which is an antiseptic. Next, a hazelnut twig is used to clean the nostrils of the newborn in order for it to breathe easier. The hazelnut twig is ideal because it can easily be split and can be made into a form similar to a cotton swab. This makes it easier to clean out the small nasal passages of a newborn. The child's first bath consists of warm water with either an infusion or decoction of Joe Pye weed or spotted Joe Pye weed and cedar. These ingredients are believed to calm and soothe the infant. After childbirth, the mother may still seek the assistance of herbal remedies. The mother may have difficulty lactating when the child begins to breastfeed. The leaves of wild lettuce can be used in an infusion to help the mother lactate. If the mother is also experiencing cracked or sore breasts from breastfeeding, they may apply an infusion of trillium root to ease the pain. The Anishinaabe rely heavily on herbal remedies during pregnancy and childbirth. These remedies are made purely by the natural plants which grow in their area and can ease a number of different symptoms. It is clear that these medical plants play a large role in the birthing practices of the Anishinaabe.